there are a few things that I find very interesting. And, I'm pleased you focused on vitamin D, because I think everyone on this planet should take vitamin D. And I don't think that's an underestimate. And so what you may not know is if you're vitamin D deficient, it increases your risk of getting cancer. There's a linear relationship between vitamin D deficiency and cancer. And the further you go away from the equator, the less UVB you get, the greater your risk of cancer. This has been well established. And now there's really good data. If you take vitamin D, it prevents cancer. Isn't that amazing? And cancer is going to become the single most important cause of morbidity and death. It's going to take over from cardiovascular disease. And it's related to our lifestyle and all the toxins we expose to. So vitamin D, not only does it prevent cancer, it's really very good for depression. Did you know vitamin D is highly effective for the treatment of depression? And it's also really important for viral illnesses because there are many receptors in the white cells. In fact, the white cells take up 25-hydroxy vitamin D and activate it. So it's very important for the immune system. Part of the war against repurposed drugs, so there's the war against the eye drug. People don't like vitamin D. They just don't like it because if people took vitamin D, it would reduce the risk of cancer, would reduce the risk of many diseases. And so that Big Pharma don't like vitamin D. So when they design studies, they design them to fail using very low doses. To give 2,000 units a day in these randomized trials is an absurdity. It's a tiny dose, but they do that because they want the studies to fail, and as they see, it doesn't work.
Yeah.
And so the sicker you are, the more chronic inflammation you have, the more autoimmune disease you have, you want to use a higher dose. So I take 10,000 units a day, and I'm reasonably healthy. But you know what? If you have chronic autoimmune disease, if you have multiple sclerosis, you want to push up the dose. And it's exceedingly safe. It's a very safe, more of a hormone than it is a vitamin. The sun, people die if they don't get sun. Yeah. So there's a really interesting study. They looked at women who were sun averse. These are women who were petrified of the sun and avoided the sun. If you avoid the sun, it increases your risk of dying by about 25%.
Wow.
So the sun is there, if Big Pharma could put a patent on the sun, they wouldn't sell it to you.
They would.
Sunshine is really good. And, I'll tell you something even more interesting is that sunshine prevents cancer. If you have a melanoma, the best thing you can do for melanoma is to go into the sunshine. Isn't that paradoxical?
It is.
And in fact, in Italy, there are spas that offer sun tanning excursions for people with melanoma to suntan. Isn't that remarkable?
It is. It really is. The healing power of the sun. I mean, obviously you don't want a sunburn. You want the right amount, but this is amazing that the sun is actually, we are told such lies. It's just.
You don't want to, you want to spend about 30 minutes in the sun. You want to avoid using sunscreens because it defeats the purpose. Yeah. In fact, there's some data that sunscreens increase your risk of melanoma.
Yes.
Yeah. Just the opposite of what we were told.